I can see on my MAR that my patient IV needs a piggyback with added in chlorofran 560 milligrams, and that I need to place it in 50 milliliters of 0.9 saline. And I see that this 50 milliliters needs to be infused over 45 minutes, and that I do need to give 4 total doses of this. So I will do the math, and I can see on my bottle of chlorofran that it is not expired, there are no defects in the bottle, and that it is not leaking. I can see on my bottle that I do need to give a total of 1 milliliter to achieve the 560 milligrams of chlorofran. I also know that my patient is allergic to penicillin, so I would want to double check with the provider, since penicillin or chlorofran is contraindicated in patients with an allergy of penicillin, so I would want to double check with the provider and if he insists on giving this medication, or if we should change to a different medication. And I can see that I will do out my math, and I can see that I do need to do 60 milliliters an hour, and that since I have already chosen my drop set for my piggyback, that I will get 11 GTTs a minute. So 11 drops a minute, which is about 1 drop every 10 seconds. So I will start out by filling out my medication added and just having it ready to go. Okay. I'm going to perform hand hygiene and apply my gloves. And while I'm doing this, I'm going to, again, double check the MAR, the order, the medication, dose, time, route, patient, and I will do that again once I get to the patient's bedside. Okay, I'm going to prepare my needle before I even worry about swabbing off the top. Okay. Going to swab off the top of the chlorofran, and I've made sure that this is the right dose for my patient's age and weight. The maximum dose for chlorofran is 12 grams a day, so I know that this is correct. I'm going to prime my syringe with 1 milliliter, because that's how much I need to inject out. Going to remove my cap and insert the air, flip it upside down, making sure that my needle stays below the fluid line and that I am not getting any bubbles when I withdraw the medication. Okay. I am now going to recap my medication until I am ready to input it into my 50 milliliters of normal saline. I can dispose of that over there. I can put the medication away. So I will now get my normal saline 50 milliliter bag and open it. Making sure as I open it with scissors that I am not cutting the pack. I'm going to remove my normal saline. Check that, yes, this is normal saline, 0.9% sodium chloride, 50 milliliters, and I do see that it is within its expiration date, and there are no imperfections in the bag, and that it is not leaking. So I am going to go ahead and, while I have it down here, flip it over and place the medication added onto it. I'm now going to hang it up and begin to prepare begin to insert my medication into the bag. I'm going to clean off where I'm going to inject it in. Okay. And inject in my 1 milliliter. And perform the safety action on my needle. And throw it in the sharps container. Now that I have the medication in the bag, I'm going to make sure that it is well mixed in and write down the start time and the flow rate, which will be 11 drops a minute. So I am going to now go to my patient's room and start to spike my IV. So I'm going to double check, can you verify your name and date of birth, please? And I see again that she does have the penicillin and latex allergy, so I'm keeping that in mind while I'm administering the medication. So I'm going to remove my gloves, of course, before I leave the medication room, and perform hand hygiene. And now that I'm in the patient's room, I'm going to perform hand hygiene again and apply new gloves. I can see on my patient's arm that there are no signs of infiltration, phlebitis, swelling, coldness, or any bad signs at the IV infiltration site, or IV site. So it is not swollen, it is not cold or hot. It looks like a great IV. So again, this is a 10 drops a milliliter bag, and I need to set my rate at 11 drops a minute. So I'm going to take that out and right away move my other bag to the lower position. Okay, I am now going to take the cap off of this. Keep the roller clamp closed and spike my bag. Okay. And I can discard all of that into the regular garbage. I'm now going to prime my line, slowly but surely, while filling this up. Okay, my line is primed. Going to set that down while I grab an alcohol wipe. Since that one still has its cap on, it is still sterile. And I'm going to select a port to infuse on my patient. I'm going to choose the closest port to my patient, or the furthest port from my patient usually, but because of tubing length, I'm going to choose the closest one to my patient so that my tubes don't overextend. And I'm going to take off the cap and, keeping sterility, place it onto my other line. I am now going to open my piggyback all the way and adjust the rate with the main line's infusion. Oops. Alright, I have set it to 11 drops a minute, so approximately 1 drop a second. I'm again going to check my IV site, inform the patient why we did this. This is an antibiotic for your infection. And please let me know if you are experiencing any signs or symptoms of allergic reaction, and place the call light nearby. And again, remind her about the possible complications of IVs in the arm, and remind her not to include the catheter. So I am going to, again, give her the call, make sure she is comfortable, and go document that I have administered the piggyback for 67 milliliters an hour, or 11 drops. I would come back in 45 minutes to check and make sure that the medication is out, and I would apply another one after 8 hours, so probably the next shift, and let them know that after this one there are 3 more doses, for a total of 4 doses, and pass that on. Making sure my patient's comfortable, I leave the room.